The risk of heart attack and stroke happen every day, and 50% of all heart attack and stroke victims have perfect cholesterol. These conventional tests are not accurate and not effective, and in this video, I'm going to give you the 3 tests that will prove and confirm if you have any cardiovascular risk, and we're going to get started right now. Well, hello everyone, I'm Dr. Glenn Harrison, and welcome to this week's segment of Why. This is where we take just a few minutes to answer some of the most common health-related questions that I see in my clinic every day. So it's really not a question, but it's a concern, because 50% of all heart attack and stroke victims have perfect cholesterol. So the diagnostic efforts to screen, the initial screening for heart disease, this is an EKG, sometimes a stress test, and your regular lipid panel, is not enough. And right now, I was looking at some statistics here. Of 2020, 928,000 people, died from cardiovascular disease. 1 in every 5 death is due to cardiovascular disease. It surpasses cancer significantly. So the questions really need to be asked. What are we doing to diagnose and prevent heart disease? So today is about diagnosis. So there's 3 major tests that you can ask for or reach out to ask, and we can order it, of the test to truly know your cardiovascular risk process. Because I see it all the time where the typical stress, EKG, lipid panel, nothing is found, and then people have a heart attack, 6 months or a year later. So this is for the people concerned or has family illness or family risk, etc., for cardiovascular disease. So the number 1 test, the gold standard, is a heart cath, nicknamed a heart cath. It's heart catheterization, really where they go in with a tube, they inject fluid, and then you can actually visually see your coronary arteries. This is the gold standard. There's nothing better than it. It's become a lot more advanced over time, where people don't have to go under. They do it right through your wrist, your radial artery, and it is the best, by far, the gold standard. Okay, but it's not being done. We don't do it till all the other labs are showing abnormal. Then they do it. So this is the gold standard. This is number 1. I don't order this one right away. There's a little bit of risk, but minimal. Let me say that, minimal. I tend to order a lot of calcium score tests. So this is the second one. So a coronary calcium score test. I've done videos on this. And what it is, it's a picture. It's just a picture of your heart. It's a CT exam looking for calcium in your coronary arteries. If there's calcium, it's highly suggestive that there's associated plaque. And we should, in the perfect world, we should have 0 calcium. Any calcium in your coronary arteries is an indicator of heart disease. Okay, more calcium means more plaque, and you can't see plaque on an image like an X-ray or CT. So what you really need to do is you need to look for calcium, because calcium is found in the plaque. So the second best test is a coronary calcium score test. It's a CT picture, it's non-invasive. I recommend all males age 40 and up do this test. They can look like the picture of health, but they aren't, right? Not at least with heart health, okay? And even younger, if they have family cardiovascular risk or symptoms. And females, I recommend almost all females 50 and up to do this test, right? It's an amazing test, it's very accurate. So that's the second one. The third one is a carotid ultrasound. And it's where you do, and you usually don't do the carotid ultrasound test separate from the coronary artery calcium test. I usually order those 2 together. But it's where you do an ultrasound of the carotid arteries. That's a highly fragile area, or highly indicative area or weak area of cardiovascular disease. We look for plaquing, we look for thickening of the carotid arteries, and that's again another non-invasive test. So that's number 3. So we have the gold standard, the heart cath test, the coronary calcium score test, and then we have the carotid ultrasound test. These far surpass the regular lipid CMP panel, stress test, and EKG. Now, EKGs are great. They're not invasive. They're cheap. Stress test, same thing, but they don't give you the whole story. So if there is random symptoms, at least do the calcium score test to know. And then if there's something abnormal there, get in right away and talk to your cardiologist, talk to your primary medical provider to refer to a cardiologist and consider the heart cath test. It is, people really don't need to be dying from heart disease as frequently as they are. Okay, these are the tests to be done. Don't accept anything other. Now, a little bonus here. There's 2 risk factors that you should screen for if there's, it's a great thing to do. Sleep apnea. If people have sleep apnea, their risk of heart disease goes through the roof. So sleep apnea should be screened, do a sleep study, go through that. And then poor oral dental hygiene. So if people have poor oral health, there's a much higher risk of cardiovascular disease due to inflammatory cytokines getting in your bloodstream, going to your heart, and creating this plaquing that we are always looking for. So anyway, I know this is a little bit, targeted, but if you have any questions about this, let me know in the comment section. If you're trying to navigate this and worried about cardiovascular health, you can click the link below, you can schedule a call with myself, and I'll let you know if I can help, or I can point you in the direction where you can get some help. And also, I'm going to keep rolling out content like this, so hit subscribe if this was helpful for you. I'm going to get deeper into diagnostics as the weeks and the months and the years move on, and hopefully it can help you. So with that being said, I'm Dr. Glenn Harrison, and I look forward to talking to you next day where we're going to answer the why to another health-related question. Have a great day.